Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Carotid Endarterectomy. Introduction.
Clogged arteries in the neck may lead to strokes. Recent national studies have shown the benefit of cleaning the arteries in the neck to prevent strokes.
Healthcare providers may recommend surgery for people suffering from clogged carotid arteries. If your healthcare provider recommends surgery for you, the decision whether or not to have surgery is also yours. This program explains carotid endarterectomy. It talks about the symptoms and causes of carotid artery diseases. It also explains the risks and benefits of a carotid endarterectomy.
Anatomy. Two main blood vessels in the front of the neck provide blood to the brain. These blood vessels are called carotid arteries. The carotid arteries deliver blood to the arteries in the brain. Symptoms and their causes. Strokes occur when the brain does not receive enough blood.
A sudden drop in the amount of blood getting to the brain may cause a little stroke, or TIA. TIA stands for transient ischemic attack. Symptoms of a little stroke may include numbness, weakness, and difficulties with speech or vision. The symptoms of a little stroke last for only a short time.
Strokes occur when there is a loss of blood to the brain for a longer time.
The resulting brain damage can cause a loss of speech or a loss of coordination. You may need to stay in a hospital.
Large strokes can also result in death.
Around 1/3 of the people who have had a little stroke go on to suffer a more serious stroke.
If an artery is clogged, blood cannot get to the brain. This is how a normal artery looks if you cut it in the middle.
Notice the smooth walls of the artery. Arteries that look like this are common in children and young adults.
The arteries can get clogged with plaque, which consists of cholesterol debris and other materials. As the plaque layer thickens, enough blood cannot get to the brain. This condition is called hardening of the arteries. A small piece of plaque may break loose from the artery wall and float up to the brain. This piece may flow into and block a smaller artery in the brain, causing a stroke.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Treatment options.
A healthy, low-fat diet may reduce plaque buildup. Avoiding smoking can also reduce the chance of stroke. Certain medications may also be appropriate.
If your arteries are significantly blocked, your healthcare provider may recommend surgery to remove the plaque and reduce the chance of stroke. This program discusses carotid endarterectomy, the surgery to remove the plaque deposits clogging your artery. An alternative treatment, carotid angioplasty and stenting, may be recommended for some patients. In angioplasty, the surgeon threads a long, hollow tube through a blood vessel in your neck. When the catheter reaches the narrowed part, a balloon is inflated to widen the artery. In stenting, the surgeon inserts a metal mesh after the angioplasty, which makes it less likely that the artery will narrow again.
Surgical treatment.
This operation usually takes between 1 to 2.5 hours. The operation is done through an incision in the neck.
The artery is opened by an incision. The flow of blood may need to be rerouted temporarily during the surgery. The plaque is taken off the walls of the artery. At the end, the artery is stitched and the incision is closed. Sometimes the artery needs to be patched up with either a piece of vein taken from your leg or with synthetic material.
Your healthcare provider will tell you how long you are likely to stay in the healthcare facility. This depends on several factors, such as your age and medical condition. Depending on how well you do, you may go home after spending 2 or 3 nights at the healthcare facility.
Risks and complications.
This operation is very safe, but there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early.
The risks and complications include those related to anesthesia and those related to any type of surgery.
Risks related to anesthesia include heart attacks, strokes, pneumonia, blood clots in the legs. If the blood clots get dislodged, they may cause respiratory failure. Any of these complications could lead to death. These risks will be discussed with you in detail by your anesthesiologist.
Some of the risks are seen in any type of surgery. These include infection, deep or at the skin level, bleeding, either during or after the operation, a skin scar that may be painful or ugly.
Other risks and complications are related specifically to this surgery. These are rare. However, it is important to know about them.
The following organs in the neck are close to the surgical area and may be damaged.
The feeding tube or esophagus, resulting in possible swallowing problems.
The nerve that goes to the face, the mouth, and tongue muscles.
The breathing tube, which consists of the trachea and vocal cords, resulting in possible breathing problems and hoarseness.
There is even a rare chance of a stroke with paralysis, seizures, or blood clots in the brain that could lead to death. There is also the possibility of the artery clogging again in the future. After the surgery,
your healthcare provider may recommend a healthy, low-fat, low-salt diet. Not smoking and moderate exercise are helpful in reducing the recurrence of clogged arteries. Your healthcare provider will tell you how long it will take before your neck is completely healed and when you can go back to work. This depends on your age, type of work, and medical condition, as well as other factors. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Clogged arteries in the neck may lead to strokes. Strokes occur when there is a loss of blood to the brain for a longer time. The arteries can get clogged with plaque, which consists of cholesterol, debris, and other materials. As the plaque layer thickens, enough blood cannot get to the brain. This piece may flow into and block a smaller artery in the brain, causing a stroke. Cleaning plaque from the arteries of the neck can reduce the chance of strokes. Healthcare providers may recommend a carotid endarterectomy for people suffering from clogged carotid arteries. This operation is safe with good results, but complications may happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.